Hello, my name is Phil DeBiasio.
And my name is Dai-Nghia Khuong, and we are brothers of the professional pharmacy fraternity Phi Delta Chi, Beta Gamma chapter from the Milan School of Pharmacy at Duquesne University, located here in Pittsburgh, PA. In today's episode of Know Your Drug, we will be discussing Flomax, also known as tamsulosin. Flomax is commonly prescribed for the treatment and symptoms of benign prostatic hyperplasia, and known as BPH, and bladder outlet obstruction and dysfunction. Today we will be highlighting the importance of using Flomax in the treatment of BPH.
Benign prostatic hyperplasia is primarily characterized by the enlargement of the prostate gland in middle-aged to elderly men. This enlargement causes a constriction of the urethral canal. This causes eventual obstruction, difficulty urinating, and the increase in frequency of urination.
Flomax is a member of a class of drugs known as alpha-1 blockers, which relax the smooth muscle in the prostate gland. Other drugs in this class include urolzoxtrol, afluzocin, and Cardura, doxazocin. These drugs all vary in some degree, such as strength, potency, dosing, and duration of action. As stated before, Flomax is a selective alpha-1 receptor antagonist. Alpha-1 receptors are responsible for the contraction of the smooth muscle in the prostate. When these receptors are activated, the muscles contracts, causing the characteristic blocking of the urethra in BPH.
Flomax is most commonly taken as a dose of 0.4 milligrams or 1 capsule, 30 minutes after the same meal each day. If symptoms do not go away after 2 weeks, the dose may be increased to 0.8 milligrams, 2 capsules, the same time each day. Flomax capsules should be swallowed whole and should not be crushed, chewed, or opened. If you take Flomax on an empty stomach, there is an increased risk of side effects such as dizziness.
When first starting Flomax, it is important to maintain your follow-up visits with your physician to ensure drug effectiveness without serious side effects. These visits may include blood pressure screenings, lipid level testing, and urine output evaluation. While taking Flomax, it is important to be aware of possible side effects such as sudden decrease in blood pressure. These side effects presents itself as dizziness, lightheadedness, and fainting. Other possible side effects include a runny nose and decrease in semen during ejaculation. If any of the following symptoms occur, contact your physician immediately. Swelling of the face or difficulty breathing, as these may be signs of an allergic reaction or a painful erection. Also, you should avoid driving or operating machinery after taking Flomax. If you are just starting out the regimen before, you know how it will affect you.
If a dose of Flomax is missed, the dose should be taken as soon as you remember, 30 minutes after the next meal. If you miss taking your Flomax dose for several consecutive days, start with a 0.4 milligram dosing regimen or contact your doctor. Some potential drug interactions to be mindful of include blood pressure, medications such as nifedipine, atenolol, and enalapril, and other drugs such as warfarin, Zantac, digoxin, and theophylline. Notify your doctor or pharmacist of any prescription, herbal, or OTC medications you take to ensure there are no serious interactions with your medications.
If used appropriately, Flomax has been proven effective in reducing the size of the enlarged prostate. The symptoms of BPH will decrease. Therefore, the frequency and difficulty of urination will decrease. Always remember, pharmacists are the drug experts. Utilize them to ensure you are receiving the best pharmaceutical care possible and to know your drug. On behalf of Phi Delta Chi and Duquesne University's Milan School of Pharmacy, my name is Dai-Nghia Khuong.
And my name is Phil DeBiasio, and this has been Know Your Drug.